So we'll continue with the female reproductive system. So here you can see a picture of a DNC and where they take a curette, which is a spoon-shaped cutting instrument, and it's inserted after dilating the cervix, and it scrapes the endometrium. Additional related surgeries and procedures for the female reproductive system include a hysterectomy, and that's a surgical excision of the uterus. There's two types: a total abdominal hysterectomy, a TAH, which is the surgical excision of the uterus and cervix with or without the removal of the ovaries and the salpinges, and that's through an incision in the abdomen. There's also a vaginal hysterectomy, and that's the surgical excision of the uterus and cervix through an incision deep inside the vagina. Here you can see the two different types: the abdominal hysterectomy, where they remove the uterus through the abdomen, and the vaginal hysterectomy, where they remove it through the uterus through the vagina. A loop electrosurgical excision procedure, or a LEEP procedure, is a gynecological procedure that uses a thin, low voltage electrified wire loop to cut out abnormal tissue in the cervix. Mammoplasty is a surgical repair of the breast. Mastopexy is a fixation procedure that raises and firms the breast by removing excess skin and tightening the surrounding tissue to reshape the breast. Myomectomy is a surgical removal of the myomas. An oophorectomy or an oophorectomy is a surgical excision of an ovary. A pessary is an appliance of varied form, and it's introduced into the vagina to support the uterus or to correct any displacement. Salpingectomy is the surgical excision of the salpinx. A salpingo-oophorectomy is a surgical excision of a salpinx and an ovary. A uterotomy or a hysterotomy is an incision of the uterus. A vulvectomy is the surgical removal of all or part of the vulva. An amniotomy is an artificial rupture of membranes, is the artificial tearing of the amniotic sac to induce or expedite labor. Cerclage is the placement of a non-absorbable suture around an incompetent cervical opening. A cesarean section is the surgical incision made through the abdominal wall and the uterus to extract the fetus. An episiotomy is the surgical incision through the perineum to enlarge the vagina and to assist in childbirth. Induction of labor is an attempt to start the childbirth process artificially by administering a drug to start labor or by puncturing the amniotic sac. IVF is in vitro fertilization, and that's the process whereby the ova are placed in a medium to which spermatozoa are added for fertilization, which produces the zygote, and the zygote is then introduced into the uterus with the objective of full-term fetal development. TAB is a therapeutic abortion, and that's the abortion performed for medical reasons, such as when the mother's life is threatened by pregnancy. Tubal ligation is the sterilization procedure for women in which the salpinges are tied in two places and the tubes in between the ligations are removed. Contraceptive is the agent that prevents conception. HRT is hormone replacement therapy, and that's the administration of hormones like estrogen or progesterone to women after menopause or an oophorectomy. An abortifacient is an agent that produces abortion. So we've now moved on to medications and drug therapies in obstetrics. Ovulation induction is the use of hormone therapy to stimulate the development of mature eggs. Oxytocin is the hormone that causes contraction and promotes milk release during lactation. It's also used to induce or stimulate labor. Tocolytic agent is an agent used to arrest uterine contractions. Some of the specialists in this area of gynecology is often referred to as GYN, and that's a medical specialty concerned with diseases of the female genital tract, as well as endocrinology and reproductive physiology of the female. The specialist is called a gynecologist, GYN, and that's the physician who specializes in gynecology. Midwifery is the practice of providing holistic health care to the childbearing woman and to a newborn. And a midwife is a health professional who practices midwifery. The NICU is the Neonatal Intensive Care Unit, and that's the hospital department designed for care of critically ill, premature, and full-term infants. Neonatology is a medical subspecialty of pediatrics, and that's concerned with the medical needs of newborn babies through the 28th day of life. And a neonatologist is a pediatrician who specializes in neonatology. Obstetrics, or OB, is the medical specialty concerned with childbirth and care of the mother. An obstetrician, or OB, is the physician who specializes in obstetrics. Pediatrics is the medical specialty concerned with the study and treatment of children and health and disease during development from birth through adolescence. And your pediatrician is the physician who specializes in pediatrics. Reproductive endocrinology is a medical subspecialty within gynecology and obstetrics, and they address the hormonal functioning pertaining to reproduction, as well as issues of infertility. And reproductive endocrinologist is the physician who practices reproductive endocrinology. Some abbreviations that you definitely need to know: AB for abortion, CVS for chronic villus sampling, a DNC for dilation and curettage, DOB for date of birth, EDC for the estimated date of confinement, EDD for the estimated date of delivery, GYN for gynecology or gynecologist, HCG, notice the lowercase h in front, for human chorionic gonadotropin, HRT for hormone replacement therapy, HSG for hysterosalpingogram, IVF for in vitro fertilization, LEAP for loop electrosurgical excision procedure, LMP for the last menstrual period, NICU for the neonatal intensive care unit, OB for obstetrics and obstetrician, PID for pelvic inflammatory disease, SAB for spontaneous abortion, STD for sexually transmitted disease, TAB for therapeutic abortion, TAH for total abdominal hysterectomy, and that's the end of this unit.